All right. Thank you all for joining us today for UbiSim's webinar, How Immersive VR Simulation Helps Learners Develop Clinical Judgment. I'm Hillary Pennington, and I'll be helping to facilitate the webinar today. I'm joined by my colleague, Christine Vogel, who will be leading today's presentation. Christine is a lead nurse educator here at UbiSim. She is actively engaged in designing, piloting, and evaluating evidence-based immersive VR simulations for nurse learners. She has over 25 years of experience in nursing and over 12 years in nursing academia, where she developed, facilitated, and evaluated high-fidelity simulations using various modalities. Her clinical expertise is in medical, surgical, and critical care nursing, and her areas of interest include simulation for pre-licensure nursing students and mentoring faculty for integration of simulation using best practice standards. Welcome, Christine.
Thank you so much.
Before we jump into today's presentation, I just want to go through a couple housekeeping items. First, this webinar is being recorded, and we'll be sending the recording to all registrants following today's webinar. You are encouraged to ask questions in the Q&A throughout the presentation located at the bottom of the screen. We'll be answering questions at the end of the presentation, and if for whatever reason we aren't able to get to all of your questions in time, we'll be sure to follow up after the webinar. So without further ado, I'll pass it over to Christine.
Well, thank you so much, Hillary. I'm so happy to be here today, and we are going to be talking about how immersive VR simulation helps learners develop clinical judgment. And so I'm going to show the learning objectives. So upon completion of our webinar today, attendees will be able to describe the benefits of immersive VR simulation in nursing education, discuss opportunities for learners to develop clinical judgment in the pre-brief, the VR session, and the debrief, and then also apply the 6 cognitive steps of clinical judgment in the context of a heart failure scenario. And so first, what is immersive virtual reality? Well, it's a multi-sensory experience where learners don headsets. And when the learners don the headset, they're immediately immersed in a realistic virtual clinical environment. And they can see the environment around them and have a high degree of proprioception. And so that means that the learner is able to see and feel their position and movement within that virtual space. And that proprioception leads to a high degree of presence. Presence means that the learners perceive that they're present in the virtual clinical environment and they're caring for a patient that responds to them and gives them eye contact. Now, this presence often becomes disconnected with the physical world around them. And this is really important with immersive VR because when learners have a high degree of presence, they can suspend disbelief and they can focus on the authentic learning experience in front of them and ultimately attain learning objectives. Now, immersive VR simulation is an evidence-based modality with many benefits that have been well documented in the literature. And I have a few examples here of recent research that has demonstrated the benefits of immersive VR, and there's a lot more out there. So for example, recent research has recently demonstrated that immersive VR simulation has comparable efficacy to high-fidelity mannequin simulations. It can improve the cognitive, psychomotor, and affective skills of learners. Another study showed that VR learners were 4 times faster to train and 275% more confident in applying their knowledge. Immersive VR offers a realistic environment and helps learners bridge the theory-practice gap. And as nurse educators, that's what we're always trying to do. And immersive VR is fun and captivating. It's innovative and empowering. And this is really important because if learners are enjoying their experience, they'll be motivated to put forth their best effort and ultimately attain learning objectives. So we're going to talk about clinical judgment. It's a hot topic right now, and clinical judgment is considered the hallmark of expert nursing. Now, the NCSBN defines clinical judgment as an iterative decision-making process where nurses observe and assess clinical situations, prioritize client needs, and generate evidence-based solutions to provide safe client care. And according to a knowledge survey from the NCSBN, clinical judgment was rated as an important skill by new graduate nurses, educators, and administrators. Now, despite these high ratings, the evidence shows that clinical judgment is lacking among new graduate nurses. Nurses have been found to be involved in 50% of patient errors, and 65% of those errors can be attributed to a lack of clinical judgment. And only 9% of newly graduated nurses scored in the acceptable competency range for a novice nurse in a recent study. Now, as a result, the NCSBN created the clinical judgment measurement model as a framework of valid measurement of clinical judgment and decision making. So it is an illustration of the layers of clinical judgment from the broadest layer, layer 0, to the most specific contextual layer, layer 4. Now, the clinical judgment measurement model does not replace the nursing process. In fact, it builds on and expands the nursing process. So you can see the nursing process at the very bottom. Layer 4 has some environmental and individual factors that affect clinical judgment. And layer 3 is what we're going to focus on today. It's the 6 cognitive steps of clinical judgment. So I have those in a little bit more detail here. So the first step is recognizing cues, and then analyzing cues, prioritizing hypotheses, generating solutions, taking actions, and evaluating outcomes. So again, these are the 6 cognitive skills needed in clinical judgment. And these are the basis for the development of the next generation NCLEX test items and case studies. Now, nurses in the clinical setting cycle through this all day, every day with multiple patients. And so we need to provide our learners with opportunities to develop each of these skills. And UbiSim's high fidelity immersive VR simulation scenarios provide those opportunities. And we're going to show you exactly how that works in just a couple minutes. So the next slide shows some of the UbiSim scenarios. We have a catalog of diverse patients across the lifespan and lots of tutorials that orient learners to the VR environment and the equipment that they use within that VR environment. And so educators can choose from many of our pre-existing scenarios that are peer-reviewed and aligned with best practice standards. And these scenarios are actually reviewed annually by our expert nurse educators. Or they can choose from scenarios by our in the community library. And these scenarios are written and shared by our UbiSim partner programs. We also have the UbiSim editor. And with the editor, educators can customize any of the scenarios by UbiSim or by the community to meet specific learning objectives. Or educators can create scenarios from scratch, choosing from an all-inclusive list of environments, patients, supplies, assessment findings, and moulage. So it's very flexible. So scenario creation starts with a needs assessment and learning objectives in mind. And our scenario needs assessments align with the next generation NCLEX 2023 test plan, the NCSBN clinical judgment measurement model, and the AACN essentials core competencies for professional nursing education as well. So each of our scenarios have these alignments and they're available. So let's take a look at one of our scenarios, Mr. Jenkins. So thank you to everyone who voted for this scenario. We put some options out there for some different scenarios to unpack during this session today, and heart failure won first place. So we're going to take a look at Mr. Jenkins. So let's talk about when can clinical judgment development start. And so when we look at a simulation scenario, according to the INACSL standards of best practice, it goes through a series of steps from the pre-briefing to the immersive VR session, the simulation, and then the debriefing with session feedback, guided reflection, and a post-simulation quiz. But we don't have to wait for the learners to put the headset on to start clinical judgment. This can start during the pre-brief. And so you can see all of our scenarios are structured according to the INACSL standards with a pre-briefing, immersive VR session, and that robust multi-tier debriefing. And starting from the pre-briefing, learners can start recognizing and analyzing cues from the SBAR report. So looking in this SBAR report, I can say that we have a 71-year-old patient who arrived to the emergency department, and he's got dyspnea, fatigue, leg edema, and a weight gain of 10 pounds. And they can also take a peek and review the available EHR documents that might be available. And so that might be a chest x-ray image or a 12-lead EKG or pertinent labs if they've been drawn and completed. And from that information, they might even be able to start developing hypotheses. And so the participant briefing that's also offered within our pre-briefing sets the expectations and establishes psychological safety, which is really important. This encourages learners to feel comfortable to make mistakes without consequences in this scenario. So learners are able to see all of this and pre-brief and be prepared for their VR session. And once they've pre-briefed, learners can start the VR session and enter the realistic clinical environment and see and hear from their patient, Mr. Jenkins. So we're going to just take a peek at what the learners see when they care for Mr. Jenkins. This video is just a minute long, and so we'll hear from him.
How have you been feeling?
Right now, I'm just really tired. I have swelling and shortness of breath when moving around.
Okay. And how long has this been going on?
My symptoms have gotten worse in the last couple of days.
Okay. Well, you did the right thing by coming in, and we're going to take a look, and we're going to take really good care of you today. Okay, blood pressure is 156/92. You mentioned that it's a little hard to breathe. I'm going to take a listen to your lungs. Do you mind if I remove your gown?
Okay.
Oh, thanks. And I'm going to sit you up.
Okay, so as you can see, the learners get to interact realistically with their patient and with the family member. You could see that there was a family member, and she also has dialogues as well with some concerns. They're able to use the assessment tools available just by picking up the tool. So for instance, the blood pressure cuff, the stethoscope, any venipuncture equipment, and they can inspect and auscultate and palpate to gather their assessment findings. And so they're able to talk with the patient and family member authentically, which is really important. We want to make sure that our learners practice those soft skills that are so valuable and so important. So let's take a look at those 6 cognitive skills of clinical judgment, starting with recognize cues. And so when learners recognize cues and do this first step, they identify relevant cues that require immediate follow-up by the nurse. And so in Immersive VR, there's realistic cues. There's the subjective and objective assessment findings. Learners get to see the patient monitors and an interactive and dynamic EHR. And so in this picture, the learners might recognize that the patient has some subjective findings. He's mentioned that he's tired and he has swelling and shortness of breath when moving. And learners really get to practice their interview technique with the patients as well. A little later on, he states, the other nurse couldn't get an IV in me because of all of my swelling. They might also notice some objective findings as well. So taking a look at the monitor or feeling his pulse, they're going to see that he's tachycardic. Blood pressure, he's hypertensive, he's tachypneic, he's dyspneic. He has 3+ pitting edema in his lower extremities. We heard an S3 on auscultation and a murmur. And we also heard those crackles in the lungs upon auscultation. Looking in the picture, I should also be recognizing that he has an oxygen requirement. He's on 4 liters via nasal cannula, and his O2 sat is only 91%. So after learners recognize the cues, they're able to analyze the cues. And this is when they can link relevant cues to the client's clinical presentation. And some key points of consideration. We want our learners asking themselves, is there a worsening or an improvement in the client's condition? Is there a new problem developing? And which potential complications is the client most at risk for? And so in this picture, learners analyze dynamic cues and consider that the client has a history of heart failure and he's had a previous STEMI 4 years ago. And he also says that his symptoms have gotten worse in the last couple of days. Now, once learners have recognized and analyzed cues, they can prioritize hypotheses, the third step of clinical judgment. And so this is where learners identify which explanations are most likely and most serious and why. They should be thinking about what are the priorities of care based on the client's health problems. And learners have the opportunity to prioritize in real time with a sense of urgency. And that prioritization really guides the patient's plan of care. And in this picture, the learners see that the vital signs have been changing. He's becoming more tachypneic, more tachycardic, more short of breath, and he's really anxious at this point. Family members are asking questions, which is really building urgency as well. Physical assessment findings evolve. His lab results have just become available, and so we can see he's got an elevated BNP and a low potassium as well. And so learners have all of the necessary information that they need to determine the priorities of care. So they should already be thinking about, is the priority oxygenation? Is he at risk for EKG changes? He's really anxious and he's getting more hypertensive. So they start thinking about those hypotheses. And then the fourth step is to generate solutions. And this is where the learners are challenged to generate solutions and identify priority interventions. And there's lots of ways to generate solutions in immersive VR. So learners can think about which interventions and standing orders are prioritized. And they can also pick up the phone and discuss with the healthcare team and recommend interventions. And they can determine which interventions would be contraindicated as well. So even if they have orders or it would help the client's situation, they need to think about all of the aspects. Is this really contraindicated with the client's status? So in this picture, the learners are exploring the EHR and they're generating solutions by identifying actions that can achieve a desirable outcome. So they're thinking about, do we have the tools that we need to help the patient? Do we need to call the provider and recommend interventions using an SBAR communication? Are there any independent nursing interventions that could help right now? Taking action is the fifth step, and this is where learners take actions that address the highest client priorities. And so learners are able to prioritize the order of their nursing actions and medications to administer, and then also when to call the provider for further guidance. Now, the ability to prioritize nursing care is key to succeeding on the next generation NCLEX and providing safe client care. And in this picture, the learners take action and they prioritize oxygenation, which is an independent nursing action of raising the head of the bed. They also needed to call the provider for medication orders, so they did their SBAR report. And then they're giving their stat furosemide. They got an order for potassium scheduled for now and then routine medications. So they were able to prioritize all of those items. Other actions may include additional assessments, client education and reassurance, documentation, and performance of nursing skills. So once the learners take action, the next step and the last step is to evaluate outcomes. And this is when the learners determine if their actions were effective. So they can reassess the client and they can also review any lab or imaging results that may be available. And they compare their observations against expected outcomes. And these events occur in real time, which allows for continuous evaluation. And by determining what clinical reassessment findings indicate, whether they're improving, declining, or no change at all, learners can determine if the actions were effective, ineffective, or unrelated. And in this picture, learners reassess Mr. Jenkins, and they see that his assessment findings are slowly improving. So it's realistic. So these interventions in VR aren't going to be magical and fix the patient immediately. They're very realistic. And so he still has abnormal assessment findings. But he's starting to diurese. His vital signs are slowly stabilizing. He's breathing a little bit easier and he's less anxious. So learners can see that we're trending in the right direction. Therefore, they can see that their actions were effective. So the learners have been through the pre-briefing and the VR session, and immediately after, once the learner has completed the simulation, they can immediately view the session feedback that automatically generates evidence-based feedback curated to the learner's performance in the VR session. The learners can see how long they were in the scenario. They can see their critical actions. And so these are the items that the learners are expected to do. And our software captures if each critical action is done or not done and provides feedback to the learner. You can also see performance gaps and additional actions with evidence-based rationales and references. And learners can also watch or listen to a recording of their session. And that's really important if they want to work on their soft skills. They can see what their interactions were like and hear what their communication was like and really reflect on improving their practice. The debrief includes the session feedback and the guided reflection, and then the post-simulation quiz. So the next part after session feedback is the guided reflection. And so this guided reflection is based on the Pearls debriefing framework and really helps learners to reflect on the experience and identify key takeaways to improve their practice moving forward. And so reflecting and debriefing helps learners to understand how they reached a decision and helps connect theory to practice. And this is really flexible. So faculty and facilitators can have learners complete this guided reflection independently, in groups, or as a class. So it's very flexible in that way. And then finally, there's a post-simulation quiz that includes standalone quiz questions with multiple choice, multiple response, and matrix formats. Our scenarios include an unfolding case study, which consists of a two-part clinical situation describing the patient's condition at a future point in time, and then 6 questions that correspond to each cognitive step of clinical judgment. So for instance, this unfolding case depicts Mr. Jenkins 2 days later with a complication. And there's 6 questions from recognizing cues all the way to evaluating outcomes, giving learners another chance to practice clinical judgment. And this is really helpful because one of the biggest changes to the next generation NCLEX involves direct measurement of clinical judgment and the use of evolving case studies measuring layer 3 of the NCSBN clinical judgment measurement model. Okay, so learners need opportunities to practice developing clinical judgment. Well, they need it to pass the next generation NCLEX, but more importantly, so that they can provide safe and effective patient care. And immersive VR is an evidence-based modality, and it's a safe space where learners can practice the development of clinical judgment in a setting that is realistic and really compelling. And this is just one of the many UbiSim scenarios to choose from, all of which can be edited with our intuitive editor to meet specific learning objectives. And the UbiSim editor allows for customization of content and thus creation of additional diverse and meaningful scenarios to further learners' clinical judgment. So thank you for walking through the 6 steps of clinical judgment with me and our patient, Mr. Jenkins. And I also have some references here. So thank you so much for attending. If there's any questions, I'm happy to answer those.
Yes, thank you, Christine, for walking through that presentation. And we do have a few questions. Feel free to, as Christine just noted, to type in any additional questions that you have. We have a few minutes left to review. So the first one I'm seeing is, how many active participants can care for a patient during a scenario?
Oh, that's a great question. And so the presentation really highlighted just one active participant within the scenario, but our scenarios actually allow for up to 3 active participants working together within that scenario. And so it's really great for learners to work together, collaborate, communicate, and have teamwork. Now, those active participants don't need to be in the same location. So they could be in different cities and different locations, and they could all still collaborate together in the VR session. And there's a lot to do in the session. So one learner might be assessing the patient. Another learner might be looking through the interactive EHR, seeing some new labs, some new standing orders. And another active participant could be talking with the family member, answering questions. So there's a lot of things to do within the VR setting as well. Also, there's an opportunity for ghost observers to join as well. So 3 active participants that can be caring for the patient, but then observers can actually pop into the session and view it as a ghost observer. The active participant will not see or hear the ghost observers, but those ghost observers will have a front row seat to the action of what's happening in the immersive VR setting. And so those are some options that are available.
Great.
Oh, I just also want to mention that the feedback report will also show which active participant did which action. So that's really important as well. They're working as a team, but we can also see and reflect on their actions and their teamwork within that debrief.
Okay, great, thank you. And then there was a follow-up to this. So it looks like UbiSim is complete immersion. How long can learners be in the headset safely?
Oh, that's a great question as well. And so the health and safety warning specifies that participants should take a break after 30 minutes in the headset. So a good rule of thumb is to ease into wearing the headset for only a few minutes at a time and increase the amount of time using the headset. All of our scenarios are between 15 and 25 minutes. So simulation scenarios really shouldn't exceed 30 minutes, and our learners can perform that within that time as well.
Okay, great, thank you. Next question is from Patricia. How does the call to a healthcare provider go to give an update or obtain a secondary order?
Oh, that's a great question. And so active participants have access to the phone in the room and they can call the provider. And there's dialogues that are programmed into the scenarios. And so the provider would say things like, tell me more about the situation, more about the background. And so they can say things like, call me back when you've gathered your assessment, because oftentimes nurse learners, nurse learners might call the provider a little too early before they've gotten their assessment, or maybe they already have the tools that they need and the provider wants them to look at the independent nursing interventions, but also the orders that have already been provided. And so also the learners can give that SBAR report over the telephone, and the provider can also trigger a new order to appear on the EHR and on the EMR as well. And so it really provides for a lot of opportunities to make the scenarios very robust.
Okay, great. And we will do one more question because we're just about at time. Susan is wondering how much physical space is required for the student to do the VR? Can they be seated?
Oh, that's a really good question as well. So the recommendation is 7 feet by 7 feet when you're in VR. And you're probably not going to need all of that 7 feet because you don't walk around in VR. You're able to teleport and it's very smooth. But we want to make sure that our learners are safe and there's no tripping hazards as well. There's also an option to sit if learners are not able to stand. That is a possibility as well. So before they go into the scenario, they'll put on their headset and become oriented, and they're able to draw a 7 foot by 7 foot boundary around them. And so in VR, if you've been in VR, that you know that if you haven't, if you extend to that space, you can see the world around you. So we want to keep our learners safe.
Okay, great. Thank you. Well, that is all the time that we have today. There are a couple other questions. So as I mentioned, we'll be following up with the responses to those following the webinar in the follow-up email, and I'll also be sending the recording if you want to rewatch or share with any of your colleagues you think might be interested. So thank you all for taking the time to join us today. Christine, thank you so much for presenting. And until next time, take care. Thank you all.